And we're happy to have Dr. Kallish again this year, and then we're excited to take her to camp with us.
I'm excited to go to camp.
Work here.
Okay, let's see. All right. Hi, everyone. So, where are we at?
Oh, by the way, we call the doctors that go to camp with us sidewalk consultants. Their job is go around and answer questions and play with you.
Yeah, so like Rob, who's a geneticist, and Dawn, who's a genetic counselor, I'm a geneticist by training. And so when Jerry asked me to talk about sort of like how to optimize health and wellness and how to be as healthy as possible, not Fabry specific or Fabry related, it's a little bit outside of my usual comfort zone. So thankfully, Jerry gave me a list to start with. So we're going to talk about optimizing health. And so that's just a little bad Fabry joke. And okay, so Jerry, as you may know, is really interested in sort of how to optimize your health, stay as healthy as possible. And so he shared with the Fabry community some time ago, and then with me, sort of a starting point. So he kind of gave me some talking points, which was nice. And it included the American Heart Association has a list that they've put out of 8, I think they call them essential, it's on the next slide, but essential things to do for your health. And then he suggested a few of his own, which I called Jerry's 5. And then I thought if I was going to come here and talk to you, I should have a few extras. So those are Staci's 4. So we're going to talk about all of these things and sort of how they may be able to help you, in addition to Fabry-specific treatment, but just general things that may help you feel as good as possible. And some of these questions have come up already through Rob, and then some of the questions that were just asked of Dawn. Okay, so we've already sort of covered this, that Fabry disease is chronic and really requires multidisciplinary care. So while we've talked about that actually I don't think we've talked about recommended assessments and evaluations yet, but I'll mention those in a minute. And that Fabry-specific therapy and other supportive therapies can lead to improvements in your symptoms and prevent complications. So there's Fabry-specific therapy I will touch on, and then you'll hear from a lot of the industry partners later after the break, supportive care, but it's really important just to sort of maintain healthy habits to optimize your health. Okay, so these are the American Heart Association's Life's Essential 8, which makes them sound really important, and I think they pretty much are. And we're going to go through some of these, and I will just sort of disclaimer that I am a pediatric trained geneticist, so some of this, not my usual day-to-day, but we'll talk about it. Okay, so obviously, and some of these are things you've hopefully heard for a long time, but we're going to try to talk about some reasonable strategies. So important to eat well and to maintain a healthy weight. So someone just asked, perfectly timing this up, about nutrition. And while Dawn said there's no specific guidelines for Fabry disease, there are guidelines in general for how to do this. So it's important, as Jerry said and as Rob said at the beginning, to individualize everything that you hear for yourself and to talk to your own healthcare team. But it can be helpful to understand what really is healthy for you. We know that we don't need any special diets to eat well, so I'm sure if you are on social media, you see all of these sort of fad diets and special foods, not necessary, but really important to eat a variety of different food types and to eat throughout the day. And so here's a little plate in the bottom right that sort of shows all of the different food groups, fruits and vegetables, whole grains, plant-based proteins or lean proteins, and low-fat dairy. And fruits and vegetables, I know, can be really challenging sometimes for people. When you buy fresh fruits and vegetables, they go bad quickly. You have to go to the store a lot. They can be expensive. But it's actually, you don't necessarily need fresh fruits and vegetables. So canned vegetables, frozen vegetables also can be equally nutritious and part of a healthy diet. You obviously want to limit sweetened drinks, so like sugary drinks like juices or sodas, alcohol, foods that are really salty or fatty, processed foods, things like that. Using plant-based oils are healthier than coconut and palm oils. And the AHA has put little heart healthy check marks on some foods. So if you see this red check mark, sign that it may be heart healthy for you. Looking at nutrition labels can be helpful as well. And then cooking at home. So when you cook at home, which is hard to do, I understand, at least you know what's in your food more than if you're buying it in a store or a restaurant. And then water and fiber are important too. Okay. So the AHA also recommends being active, and I think we all know know well that exercise is good for the body. It's also really good for the brain. We know it also is really challenging for people with Fabry disease who may have fatigue, chronic pain, things you've heard about already, decreased sweating, which can make getting outside and being active really hard. The AHA recommends 75 minutes of vigorous activity, so running, swimming, jumping rope every week, or 150 minutes of a more moderate activity. Stretching is also important. And just this morning in like the email, I get a daily email from the American Medical Association, talked about a little study that showed certain kinds of stretching of like your back and your shoulders can help lower your blood pressure, at least for the short time. So stretching is helpful. And then just some general tips from the AHA. So, if possible, to think about exercise as a moment for yourself to sort of unplug or recharge. Think about it as good for your brain in addition to your body. If possible, to use it to connect to others. So if you have friends or family members who live close to you and are also struggling with this, if you make a date with them or plan a walk with them, then you can maybe get some social time and some exercise as well. And making it a habit or an appointment. And I know for me, with my schedule, and I know your schedules are similar, every week it's sort of like, where can I put in some exercise? And I'll put it on the calendar to make sure that I actually do it. And that helps me most of the time, actually do it. And we know that exercise can help people be less stressed, can be happier, and help with memory. Okay, so this one I think is the one that should go the most without saying. So there's no amount of healthy tobacco or nicotine for anybody. And so we as healthcare providers really recommend that you avoid these entirely. We know that tobacco and nicotine products increase your risk for many conditions, so heart disease, stroke, diabetes, many cancers, so not just lung cancer from smoking products, but also mouth and throat cancer, bladder cancers, others. But we also know that once you start using these products, they can be really challenging to stop. People can have mood swings, anxiety when the effects are wearing off, and that these can also lead to premature aging, not just for your appearance, but memory and concerns as well. So there's some really good literature supporting how to stop using these products if you are. So recommendations are to set a date, to decide, I'm going to stop next Thursday. Usually say within about a week to 10 days. Make sure that you're thinking about what's going on in your life. So if you're moving next Saturday, Friday is probably not the date to quit. Think about how you're going to do this ahead of time. So do you want to just try to stop cold turkey, or do you want to gradually reduce how much you're using? Do you want any aid? So there are some medications that can be prescribed by your doctor that help reduce cravings, or there's nicotine replacement. So these are like patches, gums, things like that. And then come up with a plan for what you're going to do when the craving or the urge comes. So am I going to get up and take a walk for 10 minutes? Am I going to call, my friend? What am I going to do if I have that urge to try to delay it? And often if you delay for 10 or 15 minutes, that urge might pass. And then think about what are your triggers. So for some people, the trigger is like, here's my habit, I have my dinner, and then I sit down and I smoke a cigarette. So think about that so you can plan ahead. And there's support available from this toll-free number from Quit Now.
So what's happening in your blood vessels from Fabry disease, and what that makes this more important than it is for a lot of people?
It's a really good point, Jerry, and I say this to patients all the time. I say, when I know that they are using tobacco products, I say, I don't want anyone, as a physician, I don't want anyone to be smoking, but if you have, there's a list of conditions, but Fabry is one of them, then it's especially not a good idea for you. So we know that this nicotine and tobacco use causes your blood vessels to constrict. It increases the risk of atherosclerosis, which is that plaque building up. It increases your blood pressure, and all of these things further increase the risks that we see in Fabry disease, where we can see storage of GL3 in those blood vessels, and we already see increased risk of kidney disease, of stroke, of heart disease. So they're compounding, so especially not a good idea. Yes. At least double jeopardy. Here's other things that increase your jeopardy, so triple or quadruple jeopardy. So, and I put these all together because we don't really have time to talk about them in a lot of detail, each of them, but managing blood pressure, cholesterol, blood sugar. So these are all conditions when your blood pressure is too high, your cholesterol is too high, your blood sugar is too high, that increase risks of heart disease, of stroke, of kidney disease, which, as we already know, are increased in Fabry disease. So you heard a little bit from Rob, and then you're going to hear from nephrology and cardiology, I think, after lunch. So I just listed up here some of the numbers to be aware of. So again, talk to your doctor about specific goals for you. But for blood sugar, we know that fasting blood sugar in the normal range is good, and that when you have diabetes or elevated blood sugar, that's as much risk for your heart as if you've already had a heart attack. So you want to reduce, control blood sugar as much as possible. Blood pressure increases the risks of all of the conditions we're concerned about in Fabry disease. So increases risk of stroke, increases risk of heart disease, increases risk of kidney disease. And then for cholesterol, we know that there's the LDL numbers are not healthy for your heart, so we want those to be lower. The HDL numbers can be protective for your heart. Okay. And then for me, this is maybe the hardest one, so healthy sleep. And I think we all have lots of things to do and lots of things we want to be doing, and getting sleep is not always easy. But we actually recommend that adults get somewhere between 7 and 9 hours of sleep every night. Anyone get 7 or 8 to 9 hours of sleep every night? Oh, a few hands. Good for you. I'm good. This is a goal I'm working on. So we know that when you have enough sleep, it improves your brain function. It can improve your mood and energy. Not getting enough sleep and being overly tired can weaken your immune system and make you at risk for infections. Sleep is important for repairing your cells and your tissues, and also reduces risk of chronic disease overall. So as we've talked about, when you have Fabry disease and you're at risk for other chronic complications, getting sleep can help reduce your risk for those. So here's the AHA's recommendations. And I think, again, these are things we all could do. So try to dim lights before you go to bed. So turn down some of the bright lights in your room, can signal to your body that it's time to go to sleep. Also, this includes all the lights on your screens. So trying not to use screens before you want to go to bed. I know easier said than done, but also using glasses that block blue light, or some phones and tablets have settings where they change, I think it's a red light filter, that reduces the amount of bright light that's coming from your screen to your eyes, so your eyes can start to think it's time to go to bed. Kind of like when the sun goes down and it gets dark, it's supposed to tell us, get ready for bed. Try to go to bed and wake up at the same time every day. This is especially hard when your schedule might change, when you have a family and their schedules might change, when you're really overtired, and so when you get one day that you can sleep in and you want to do that. Establishing a nighttime routine, so whether it's a shower before bed or a cup of tea or whatever might help you, again, wind down and tell your body that it's getting to be time to go to sleep. And then turning your phone off or setting it to do not disturb can be really helpful, so you're not getting lots of notifications. And if you don't know, that your phone probably has a setting where you can allow certain people to ring through. So obviously we don't want to miss important phone calls from our family members, but that you can at least try to block out all of the other things, or turn off your emails or your notifications from social media and things like that, so they're not waking you up all night.
I don't want to keep making things about me, but I have tidbits to share with you. So I've learned over time, when you get to be older with Fabry, which we can do now, I've learned that if I get at least 6 hours of sleep, which I rarely do, the edema in my legs goes almost back to normal. My legs go almost back to normal. But if I don't get 6 hours sleep, they stay swollen all the time.
So that's a good transition, is Jerry doesn't want to make it all about him, but here's Jerry's 5. So here's Jerry's 5, and they're all really good recommendations. And one of them is about, actually the last one is about edema, so we'll talk about that when we get there. As mentioned, so adhering to recommended assessments. So these are the recommended assessments from the most recent guidelines, which are about 7 years old now for adults. And so what is sort of the minimum of evaluation? So we recommend every 6 to 12 months a general evaluation. And ideally, this is with someone who is specialist in Fabry disease who has experience. So my preference as a geneticist is that this is with a geneticist, because I think we're really like the primary care of your rare disease. So at this visit, whatever healthcare provider you're seeing is going to ask about your updates to your medical history, the symptoms that you have, any changes in your health, or your medications that are prescribed by other doctors. They're going to ask about updates for your family history. They should ask about quality of life and how you're feeling. They should, and then review sort of all of your body systems. And so that's why I think it's ideal for this to be with someone who's familiar with Fabry disease. I know that not everyone has the benefit of living close to a geneticist or a center that has many specialists experienced with Fabry disease. So there's a couple of models to do this. This might be, you see one specialist, again, whether it's a geneticist or if it's a cardiologist or a nephrologist who's closest to you, and then any other care you need, you do locally. Some centers like ours at Penn in Philadelphia, we try to sort of block time together for our patients. So if we have patients who are coming from 3 to 4 hours away, which is maybe doable once or twice a year, we try to get them to see the cardiologist, the nephrologist, the geneticist, get their imaging all in the same day. It's a really long day, but they can at least get a lot of care that way. We're using more and more telemedicine when possible, so maybe they get their imaging on site, but they talk to their doctors by video. Or just keep in mind also that your providers, if seeing someone who has experience is just not at all possible, you live too far from any of those centers, most of us who see a lot of patients with Fabry disease are really willing to talk to healthcare providers who don't have a lot of experience to help give them guidance. As part of this visit, we recommend at least annual monitoring of those biomarkers, which Dawn has talked a lot about, so I'm not going to talk about further. And then we recommend organ-specific evaluations, so kidney evaluations, and these include measuring the protein in your urine, which I'm going to talk about a little bit more in a second, but also how your kidneys are functioning, at least every year for everybody, but more frequently if you have kidney disease or at higher risk for kidney disease. Evaluations of your heart, at least, so blood pressures and at least the listening to your heart can happen anytime you see a doctor. But at least every year, and we should also be doing an EKG and an echocardiogram and Holter monitoring to measure your heart rhythm and your heart function. Some blood tests, so the BNP, especially if you have known heart muscle disease, cardiomyopathy, or heart rhythm disease, other assessments. Also recommend brain MRI. Current guidelines recommend every 3 years or so, and consideration for measuring of orthostatic blood pressure. So that's if your blood pressure drops a lot when you go, for example, from sitting to standing, which can be a sign of autonomic dysfunction. And then additional evaluations really as needed based on your own personal medical history, your family history, sometimes your variant or the type of Fabry disease. And some of these, at least in adults, we may do as needed. So I think we know that hearing concerns and tinnitus can be a concern. So recommended audiology evaluation really as needed for adults who might be more sensitive. Again, the recommendations change for kids and then also vary based on your specific disease. I'm not going to talk a lot about this, but I actually realized that in the beginning, no one talked super much about Fabry-specific therapy. So I like this image because it talks about all of sort of the options for Fabry-specific therapy. Take a closer look. So, and like I said, you're going to hear about some specific therapies this afternoon. So these are really looking at the strategies to treating Fabry disease. So as you heard from Dr. Rob, people who have Fabry disease are either missing an enzyme or have a deficient amount of enzyme or an enzyme that's not working. And so that leads to the buildup of this GL3 or GB3 in the lysosomes of our cells. So that's what you're seeing in these cells, which are these green things at the bottom, or the lysosomes of the cell, which are these green things, and the GB3 here as it's labeled as building up. So the strategies that are currently available are in the right side of the bottom half, which is enzyme replacement therapy. This is replacing the missing enzyme or the deficient enzyme given by IV. The therapies that are approved for every 2-week dosing. The other approved therapy in the US right now is in the middle on the left, which is a chaperone therapy. This is a therapy that's available to some people who make an abnormal protein, but it doesn't make it to the lysosome normally. So the chaperone, which is, you can see these little blue arrowy things, bind to the abnormal enzyme, help them go to the lysosome and work. They're also in clinical trials in the bottom left corner, substrate reduction therapy. These are therapies that help you make less GB3 so that there's less to be stored. And then at the top, on both sides, you can see different methods of gene therapy, which are methods to introduce just once a corrected gene so that your body can make it itself. And then these are just the approved therapies. So again, these are enzyme replacement therapies and chaperone therapies. And then some of the therapies that are in clinical trials, which include substrate reduction therapies and gene therapies. And there actually are representatives here from most of these industry partners, so you'll hear from them later. Okay, important to stay hydrated. So we know that our bodies are mostly water. Most people lose water all the time through urine and stool, through breathing, and from sweating. If you're able to sweat, this is worse, high temperature, high altitude when you're not feeling well. The CDC recommends a lot of water every day, somewhere between 70 and 100 ounces for adults. It's very important, though, this is maybe the most important part, that if you have decreased kidney function, if you have cardiomyopathy or heart disease, that you may not need this much water. So please talk to your doctor before you start drinking a lot more water. If you feel thirsty, or if your urine is really dark yellow, and this is the first time I've ever shown pictures of urine colors on a slide in a talk, but that may be a sign that you need to drink more. Water is your best source. Carrying a bottle can be helpful. I think mine is on the table back there. But also fruits, vegetables, low-fat dairy, other unsweetened beverages all count. Okay, and then as Jerry mentioned, edema already. So we know that edema can be a concern for people with Fabry disease because of Fabry disease alone. Can also be worse in people who have heart failure or cardiomyopathy. We also can see venous insufficiency, which is when the veins in the legs just get kind of bad at pushing the blood and the fluids back up towards our heart. So in addition to sleeping, which is probably helpful because it helps you raise your legs and keeping your legs elevated is helpful for reducing edema. Also, compression socks or stockings can be really helpful, and I recommend these for people when they're on their feet for a long time. Or if they're going to be traveling, they can be really helpful as well, or if you're immobilized. We know that moving around and exercising can help improve circulation and reduce edema, limiting salt intake, lymphatic or massage, so even just massaging your legs to help keep fluids moving, and then diuretics, which are medications that reduce fluid retention, can be helpful, especially for people who do have decreased heart function. Okay, and then managing the albuminuria, or the protein. This is a specific type of protein in your urine. And we won't talk about this much because you're going to have a talk from a nephrologist later, but we know that with Fabry-related kidney disease, we can see protein in the urine as the earliest sign. Fabry-specific therapies can help slow or stop this. And then there's other medications that are recommended and can be complementary. So many people may take medications called ACE inhibitors or angiotensin receptor blockers. These are medications that are generics and with prils or sartans. And these are shown to reduce the protein in the urine in general and can protect the kidneys for people who have chronic kidney disease. But there is specific data that's showing for people who have Fabry disease and chronic kidney disease that these have benefit when added to a Fabry-specific therapy. There are newer medication class of drugs that are SLGT2 inhibitors, and these are glifosins, and they also have been shown to have benefit in people with kidney disease in general. There is not yet specific data in Fabry disease, but some studies are ongoing. Okay, and so after all that, I was like, what's left for me to suggest? But we have a few extra now known Staci's for. So, staying cool in the heat, and this can be especially difficult for people with Fabry disease. So some ideas for staying cool in the heat are trying to stay inside if it's possible and if it's air conditioned there, or staying in the shade as much as possible. Again, staying hydrated and drinking extra water when it's very hot out. Again, discuss that with your healthcare team first. Avoiding really strenuous activities when it's especially hot out. Wearing light or loose-fitting clothing can be helpful. Using fans, so even a handheld fan, or you may have seen some people have fans that now like you can put around your neck or wear on a lanyard like your ID badge that can blow air on you wherever you're going, so that can be helpful. So can cooling vests or even just a cool wet towel that you place on your skin. Putting that in the back of the neck in particular can be really helpful and can help you feel like you're cooling down. And then taking cool showers or even just spraying your skin with cool water, which I haven't seen, but I feel like you could take put some icy water in a spray bottle and walk around and spray. It might help you feel a lot better if you have to be outside in the really hot weather. Okay. You've heard a little bit about Fabry-related pain already, so I don't want to talk about it too much, but we know that, I think Dawn has gone to the other session because this is some work that she was involved in, but we know that people with Fabry disease have a lot of different types of pain. We know that Fabry-specific therapy can help lead to improvements. So these charts on the left show sort of how much time from when starting Fabry-related therapy people saw improvements in their pain, so in the order of months, with most people seeing some improvements, by 8 months to a year. The top right is breaking down by sex. The bottom left is breaking down by classic versus non-classic disease. And then the bottom right again is looking at like sort of within treatment and how many people had improvements. And as Rob said, we know that people with Fabry disease have many, many types of pain. So we see improvements in many of these types of pain. And on the right shows how many people saw improvements in each of these different types of pain. And then Rob actually already talked about this, so there are some recommendations for how to treat. This is specifically talking about nerve-related pain in people with Fabry disease, but other medications outside of Fabry-specific therapies can have benefit. The first-line recommendations based on this group, and this was a consensus paper, are two of the anti-seizure medications that Rob's already talked about. We know that based on your other medical concerns, certain other types of therapies can be helpful. So some medications that are used to treat depression and anxiety can also have benefit for pain. So if you're struggling with both of those things, then those might be a better first-line agent for you, but there are guidelines available to discuss with your healthcare team. And we know that pain management specialists can be helpful when therapies that you're trying are not working. Okay. I know both Rob and Dawn have talked a little bit about mental health and impact of Fabry disease on mental health. So seeking care for this is important. We know depression, anxiety, even executive functioning difficulties are common in people with Fabry disease. And we know that there are some studies that show that Fabry-specific therapies can help these, but also therapies for people without Fabry disease can be helpful as well. There's a lot of overlap with what we've already talked about, so improving your physical health and mental health through eating well, exercising, getting good sleep, but also staying connected socially to your family and friends for support, managing stress however possible, and then professional support when helpful, so either through cognitive behavioral therapy and other talk therapy, through support groups of people who understand what you're going through, and potentially people with Fabry disease, and medications when appropriate and prescribed by one of your healthcare team. And then finally, and for those of you who I've met before and when we talk later, my background before I was a geneticist comes from patient advocacy groups, and I think that finding benefit in community and in your people who know what you're going through is really important. And so I would encourage you all to continue to find benefit. This is the map from Jerry's website of where people come from. This is the picture of everyone who was at the meeting last year. And so to find benefit in communities like this where you can talk to people who not just understand what you're going through, but may have experiences that helped them that they can recommend to you. And then also to seek benefit in the community of those of us healthcare providers who do a lot of work in Fabry disease and are really interested and engaged in partnering with patients and their families to help everyone live their healthiest life. And that's it. That is it. You're welcome.